I'm Nigel Cater. I'm Chief Executive of the Oral Health Foundation. For those of you who don't know the Oral Health Foundation, we're a charity based in the UK, a not-for-profit, an NGO, and for the last 50 years, established back in 1971, we've been promoting the benefits of good oral health to the public with the aim of improving people's oral health worldwide. So we're very aligned with the aims of the Alliance for a Cavity-Free Future in terms of seeing better oral health. As a charity, we have a broad range of educational material, which we distribute both via dental practices and also as a resource online, which is visited by some 2 to 3 million people every year. In addition, we're very active on social media, and have over 100,000 followers on various social media platforms. We run 2 major annual campaigns a year. That's National Smile Month, which has now been going for over 45 years, which again focuses on the benefits of good oral health and the benefits of having a good smile. And in addition, in November every year, we run Mouth Cancer Action Month. As well as this, we have a lot of proactive activity with the media, both broadcast and print, and we also produce podcasts and other YouTube videos and so on like that, as well as running a national helpline. So a broad range of activities. So want to look at how we might use the COVID crisis to potentially allow us to move a little bit further in our journey towards a cavity-free future. So what I want to cover is some understanding the barriers for a move towards prevention for different audiences. The pandemic itself, whether this has provided a total challenge, whether this has moved things backwards, or whether in fact we can see some opportunities there within that. And to examine for various groups how changing attitude can potentially lead to behaviour change. Many of you will be familiar with Richard Watt's upstream downstream approach towards prevention in oral health. And really we're looking here at from the highest level upstream policymakers through to events in the community, through to events in school, through to actually looking at within dental practice, chairside dental health education, clinical prevention, and how this then affects the individuals. So we have a number of audiences here that we're going to look at. So looking at the audiences that I want to talk about today, it's really mobilizing the 4 Ps, and these are the public. So this is the population as a whole, including those who don't go to the dentist on a regular basis. Patients in dental practices and how they relate with the dental practice, the practitioners themselves, and then very importantly, policymakers. And I think you will see from that that actually everybody has a part to play. We're not going to achieve a cavity-free future working in isolation as dental professionals, or as media people, or as politicians. If we're going to achieve this aim that we would like to achieve, we've got to look at it together. So how do we mobilize the public? We can do this through awareness campaigns, through advertising, and it's important that we try and refocus the public's thoughts about dentistry, where they see it as the dental practice is there as their repair shop. the dental practice and their dental team are responsible for their oral health. We need to create a real mind shift here so that the public realise that for the 360 plus days a year when they're not actually in the dental practice, they're in charge of their own oral health. They need to take ownership for it. They need to see the dental practice as being there in support, and they need to become proactive around their own dental health. So this is really moving them towards, as I said, not regarding the dental practice as a repair shop, but as supporting them in that preventive journey, and that treatment is not the aim of dentistry. Actually having a healthy mouth is the aim of dentistry. Referring to awareness campaigns there, you'll see our logo for National Smile Month there, which again provides a focus for people being able to think about what good oral health and having a nice smile means to them. So benefits to the public, appreciating the value of a smile and a healthy mouth. And there's a lot of research out there that shows the value of having a healthy smile, not only in the way that many people think of it in terms of their social relationships and how they relate to other people, but also in terms of their job prospects. Having a nice smile has been proven to help you get a job. And once you're in that job, it's also invaluable in getting you promotions in that job. One of the real motivators for the public is the realization that oral health and their teeth are not just about their mouth, and that increasingly we are seeing the wealth of connections between oral health and general health. And indeed, what we need to do as professionals is put the mouth back in the body, look at oral health in a holistic way. And in that way, people can start to appreciate the value of good oral health and start to move towards a more preventive approach. The key thing to that is them taking charge of their own oral care regimes, making sure in their mind how important that is, and recognising the benefits of good oral health. Clearly, if currently they regard the dental practice as providing repair and restoration for them, if they move towards a preventive approach, then the costs of their dental care are going to become less. They're going to become more motivated within a practice, and they're going to value that relationship with their practice even more. So moving from being a member of the general public out there in the community and moving that patient into the dental practice, and looking in the context of post-COVID. We're aware from various surveys that patients are worried about returning to dental practice, and they need to be reassured that dental practice is a very safe place, and that the PPE requirements that have been introduced into dental practices really make it one of the safest places to go for treatment. To support that patient journey, what we want to do is look at getting better communication between the dental practice and patients. If we're truly to move towards reducing cavities, towards a cavity-free future, then we need to look at that patient preventive journey being supported not just for the 1 or 2 days a year that they're in dental practice, but throughout the year. So by getting better communication from their dental practice encouraging them to embrace prevention, and recognizing the importance of the period in between visits for maintaining oral health. So often the patient leaves the practice at the end of a course of treatment, and that is the last communication they have with that practice until their next checkup is due and they're due to visit the practice again. What we need to do is develop patient journeys, develop patient preventive journeys to support that preventive approach to dentistry and reduce the amount of disease that we're seeing, reduce the treatment needs. And we need to create that mind shift in our patients that we're there to support and help them in their preventive journey. And in that way, we're really creating additional value for that relationship and for the patient in their relationship with the practice. So for practitioners, there are clearly benefits to this preventive approach as well. And the COVID pandemic, with reduced productivity, with fallow time in between patients, offers a real opportunity to use that downtime to communicate better with patients, to adopt a new preventive model. If the throughput of patients influenced by COVID is going to be less, then this provides an ideal opportunity to actually embed prevention in practice and ensure that patients actually need less treatment. During COVID lockdowns, there's been a lot of embracing of new technology for remote consultations and triage. And clearly this is going to be the way forward. The patient can be supported in between visits. The patient can receive patient journey videos to help them in their move towards less disease and more prevention and improved habits. And this can only enhance the patient relationship and lead to a healthier patient base and a more pleasant working environment, much more pleasant for dental teams to be delivering prevention and support of healthy mouths than to be treating unhealthy mouths. So if we look now at the final group of the policymakers, and we need to look at how we influence them. At the end of the day, policymakers are going to be very key towards achieving the advances that we want to achieve in prevention, because they're in charge of the budgets and the higher level programs, as well as things like fiscal measures around sugar taxation, which can help to improve oral health. Traditionally, as dental health professionals, we think about levels of disease, and indeed the title of Alliance for a Cavity-Free Future is aiming for a reduction in the number of cavities. What we do find, however, is when we talk to policymakers, actually they're not really interested in the levels of disease. So how do we influence them? How can we motivate them to get involved in oral health, to be passionate ambassadors for oral health, and what do we want from them? We've learned through our work with the Platform for Better Oral Health in Europe and trying to influence European policymakers that actually the triggers are far more around finance. So rather than the really good data that we've got about levels of, say, 12-year-old DMF across Europe, they are far more interested in the costs of dental care. They're interested in the costs at practitioner level, how much that costs for economies. They're interested in the costs of secondary dental care. When we talk about children going into hospital for general anaesthetics, for extractions, then that really is a key concern for policymakers. This then goes on into the societal effects. Children missing time from school as a result of dental disease, having reduced educational achievement as a result of dental disease. And then there is the real loss, which has been quantified in some of the global burden of disease work and some of the work of Stefan Listel, the cost to the economy through time lost from work through dental disease. Now that can be through adults having dental disease and having time off work. It can be due to their time to visit dental practices for repair work. It can be due to their time off work to take their children for appointments. And of course, the thing that policymakers are also very interested in is how that impacts on inequalities, which clearly are very much a political issue. So what do we want from them? We want them to recognise these costs. We want them to take political action, to introduce oral health promotional programmes which have proven to be successful in reducing decay levels. But the trigger to actually get them to make those policy changes is probably not in terms of talking through disease. So let's have a little bit of a look at the impact of the pandemic. We've seen at various times closure of dental practices and reduced capacity for treating patients due to fallow time. And we've seen the population oral health risk increasing as a result of that inability to access treatment. A number of surveys that we've done, particularly in association with National Smile Month, have also shown an increase in unhealthy eating habits, increased snacking while sitting in front of the computer on a daily basis, and increased sugar consumption. So there's a real potential post-COVID time bomb sitting out there in terms of increased disease, which potentially is going to lead to increasing inequalities, delayed diagnosis, and advancing disease. So this is really where the preventive approach, which we've been promoting for very many years, really comes into its own and becomes essential, both from the public and patient point of view and from dental care professionals. So we have post-COVID opportunities. We have the opportunity to embrace change, to develop new ways of working, to change from this reparative approach to prevention, and to continue to use what's been a lifeline in COVID, the digital opportunities that are now available for continuing to communicate with patients on a regular basis and between appointments. And this will help overcome the patient reluctance to return to practice. By doing this, we can change public and patient attitude. We can emphasize on the preventive approach rather than the repair shop treatment model, support patients between visits, not just in the practice. And one of the ways that we can do this, and the foundation has adapted its campaigns through this pandemic period to take very much a more digital rather than face-to-face format. We can use social media to communicate with our patients on a regular basis. We can use e-letters to communicate with them and help them in their preventive journey towards a cavity-free future. And I encourage them to look for patient information using our website at www.dentalhealth.org. This is available in 9 major world languages. And in that way, we can help support that patient preventive journey through communication and education.